common mistakes that patients make when trying to return to what we refer to as normal eating?
Um, I think it's usually overestimating their volume tolerance, um, maybe eating fast, and your brain not really having the time to send the appropriate signals that this was enough. And because we are used to that, we can eat meals pretty fast. Um, People can easily hit that point where it's uncomfortable. And sometimes people learn very quickly that that's uncomfortable and they change the behavior. But I always say our brain has a very strong memory of our usual eating habits. Um, and so we kind of have to retrain the brain to recognize on the plate what does an appropriate volume of food look like, and um, how long does it take me to eat that? You have to chew better. You have to chew your food really well, swallow, take a few moments in between a swallow. Sometimes people may need a little sip of a liquid to kind of just help the food move down. Take a breath and then take the next bite. Um, so I think the typical things that I observe in people is eating too fast, um, just having too much volume of food on their plate. Um, because we have lived in a diet culture, sometimes people still gravitate to diet foods that may be low in calories or um, low in fat. And we sometimes need to optimize the nutrient density in small volumes of food just to meet our daily requirements. Um, and then sometimes just people's habits that they may have had before surgery, if they like sugary foods or sugary beverages, that can make the dumping syndrome symptoms worse after the surgery.
I found that eating oily, greasy, fatty, fried foods with a lot of sugar just didn't do well after my own esophagectomy. And
Mhm.
those definitely led to either dumping syndrome or just feeling very, very lethargic afterwards. And
Yes.
so, good advice there.